Hello everyone. So today I'm going to discuss psychosis. Psychosis is a very important topic in the psychiatry portion, but it's a really challenging topic as well because to deal with an acutely psychotic patient, to take history and to discuss the management and to explain the management to such a patient can be very challenging. But today I'm going to discuss how you can do it easily and get good marks for it. So, psychosis can be basically, it can be because of a reason, like it can be drug induced or it can be totally idiopathic, where genetic factors may play some role. And in that case, it is called schizophrenia, where you can't find any cause for psychosis, and psychosis is prolonged as well, more than 6 months, then you label it as schizophrenia. But if a patient presents to you in the first presentation where he is acutely psychotic, you cannot label him as schizophrenia. This is the job of the psychiatry department to follow him over time, to do all the investigations, to rule out all other causes, and then come up with a diagnosis of schizophrenia. So, what you are going to do, you are just going to say is psychosis, okay? So, in psychosis, the patient have uh, altered perception of the world. Basically, there are some symptoms that are common in psychotic patient. So one is hallucination. So psychotic patient may hear things, may hear voices talking to the person, or they may see people. Okay, so hallucination, they can be visual hallucination, they can be auditory hallucination. Then another common symptom is delusions. So in delusion, the patient have firm belief about something which is false. So in delusion, the person may say that, for example, the license plates of car have specific messages for him. Or he may say that the person or the newscaster that is talking on TV is directly talking to him and giving him some specific messages. Okay, so these are basically delusions. And the patient do not have any insight about these. Okay, other than delusions and hallucinations, the psychotic patient can have mood problem. They can either be depressed, which is called as depressive psychosis, so the mood can be low, or they can have mania. Their mood can be extremely elevated. In that case, that is called as manic psychosis. Okay. Um, Other than delusion and hallucinations, these patients also have thought problems, which is called as thought withdrawal or thought insertion. So in thought insertion, they feel like someone is putting thoughts in their head. Thought withdrawal, they feel like someone is taking thoughts out of their head. And thought broadcasting means that they feel like that somebody or most of the people can hear their thoughts. So their thoughts are being broadcasted out loud. Okay. So these are some of the problems, and you need to ask about these symptoms in the history. So in the history of presenting complaint, first of all, the psychotic patient, most of them, they do not have an insight. Okay, so they do not have an insight in their problem. So it's rare for the psychotic patient to come to the doctor's office seeking help, just like the patient with eating disorder, anorexia nervosa or bulimia nervosa. So they do not come by their own. They are either brought by their parents, their partners, their friends, maybe police. Okay. So how to take history from such patient? So these patients are, they are experiencing a lot of things that are kind of scary. They're hearing voices which other people can't. They are seeing people, and it's really the whole thing is very true for them, but other people cannot see it. Okay, so they are always, anxious, or they can appear scared. Okay, or they can appear very suspicious, looking here and there. So whatever you see, like the general presentation of the patient, if it feels like that he's scared and he's looking again and again towards the door, or he's anxious, constantly shaking his leg, appearing restless. So you comment on that. Okay, to start the station, comment on his general appearance. So you can say that you seem quite distressed, or you seem quite anxious, or you seem a bit scared, or you are looking at the door. Uh, whatever you are seeing, just verbalize it. Okay, so and ask, is there anything that is bothering you? Okay, So again, it might not be easy for them to open up. So you may have to ask the question a few times. You may have to say that I'm trying to help you. Can you please tell me if there is anything going on with you? And you offer confidentiality that whatever you say will remain confidential, okay? And this room is safe, and whatever we discuss will stay with in this room or will stay confidential, okay? Then you explore the presenting complaint, because the patient, after offering confidentiality, might give you, if your rapport is good with the patient, he might give you some presenting complaint. He might tell you, I've been hearing these voices, or he might tell you, I've been seeing these people, they are following me. They might tell you something more bizarre, like MI6 has recruited me. They might say that there is a gang of people that is following me, okay? So something like that. So elaborate that presenting complaint, okay? Tell the patient that it must be very, it must be very distressing for you, and I can see that you are under a lot of stress. Can you please tell me a bit more about it? Since when has this been going on? Okay, so kind of elaborate the presenting complaint, and then ask about other symptoms of psychosis, that is hallucination, delusions, mood questions, and thought questions. Okay, so regarding hallucination, we'll ask the patient, do you see people? And do you hear voices? If the patient can see people, we can say how many people are there, what do they want from you. If he's hearing voices, we will further elaborate. We'll ask, how many voices do you hear? What do they talk about? Anything other, apart from any other thing that you have experienced that other people don't. Okay. And after this, we will ask about thought questions. So we have asked about hallucination and delusion, and now we will ask about thought questions. So we will ask, do you feel like somebody's putting ideas in your head? This is thought insertion, okay? Another typical sign, typical symptom of psychosis. Do you feel like somebody's removing ideas from your head? This is thought withdrawal. And do you think that they are trying to know what you are thinking? This is thought broadcasting. They feel like people are trying to know what the person is thinking, and they can basically hear their thoughts, and their thoughts are being broadcasted to the world, okay? Then mood problem, you'll ask about the patient's mood. How is your mood these days? Are you feeling low? You are going through a lot of stress. Are you feeling low because of it? Have you ever, when people go through a lot of stress and their mood is low, they sometimes think of harming themselves or harming the other people. Has such thoughts ever crossed your mind? Do you carry anything with you to protect yourself? Okay, so if the person is hearing voices, or if the person is seeing people, unknown people, and they're following them, he might be carrying some weapon to protect himself. So it's very important to ask this question, okay? uh, then we'll ask about medication allergies and medicine. So how is your general health? Have you been feeling unwell lately? Any fever? Okay. Allergies, you will ask, and any regular medications. Psychosocial. In psychosocial, we'll ask, who do you live with? Do you have any supportive family and friends? Do you work? Do you drink alcohol or other drugs? This is basically whatever remains of the famish that I've already discussed in taking the psychiatric history portion. So these questions are whatever that remains of famish we will ask here. Okay, how has this affected your life in general? Okay, so impact on the life in general, the work, sleep, etc. Insight. So we'll ask about the insight. Do you think that you need some medical help with whatever you are experiencing? Okay. And then ideas, concerns, and expectations. So you don't need to ask like ideas, concerns, and expectations here, because the patient, if the psychiatric patient, more often than not, they are brought by someone else. So it is, it's bizarre to ask them, do you have any particular expectations from the team today? So I'll just ask about the insight. That do you think you need some medical help, and any idea what might be the cause of whatever you are experiencing? And is there anything that you are concerned about? Anything in particular that you are concerned about? Okay. Um, then examination, you will verbalize your examination, that I would like to examine you, and I will check your vitals and head to toe examination. So that you will verbalize. Now, it depends upon the patient. Basically, the patient might let you examine him You don't need, like in plab2, you don't need to actually go and physically examine, but you just need to verbalize. The patient might say yes, the patient might say no. Okay. And then you will go towards management. So in management, you need, first of all, you need to explain the diagnosis to the patient. So you'll tell the patient, from what I gather, it seems like you have a psychiatric condition in which people experience things or hear voices or see people that are not actually there. Okay. And it is due to imbalance of some chemicals in the brain, and it is called as psychosis. Okay. There can be a lot of causes for psychosis, and it can be even without any cause. So now it again, the management depends upon the patient. If the patient is cooperative, the patient has somewhat of an insight, the patient is cooperative, he's understanding what you are saying, then you can just tell the patient, if the patient is in GP or if the patient is, either in the GP clinic or calling from home, you can ask him if he can go to the hospital, or is there someone who can take him to the hospital. Okay, and you will just explain to him that what they're going to do in the hospital. So I'll tell them that in the hospital you will be assessed by the mental health team, and they will do some blood investigations to check the cause for your condition, and they will give you some medication like olanzapine, and these unpleasant experiences, they will go away, and you will be better able to focus on your work and your day-to-day activities. So this you will do if the patient is cooperative, and if the patient is somewhat like displaying somewhat insight, then you can do this. But if the patient is not cooperative, if the patient is not displaying any insight and not really understanding what you are, trying to say, then you will tell the patient that I will send some of my colleagues, and they will have a chat with you, and they will see why is this going on with you, and why are the, why are you hearing voices? Why are these people? Why they are bothering you? Okay, so then you will, uh, tell him indirectly that you are basically sending the home treatment and crisis resolution team. Okay. So basically the home treatment and crisis resolution team, they go to the psychiatric patient who are at home, and they go and assess them there. And if the patient is basically he is psychotic, then they will admit him, okay, until the mental health act, even without their consent. So that was all about psychosis. It really is quite a challenging topic, and it needs you to be sensitive enough and not say things that can be, offend the patient somehow, and basically follow the patient's lead. And yeah, so that was all about psychosis, and I will see you soon with another video.